Hey, welcome. Welcome to the next edition of Lunch and Learn, going through the core four for treatment that I use for pandas and pans. I'm talking through from my book called A Light in the Dark for Pandas and Pans, and I'm cracking up at myself because someone texted me that you see everything backwards, so I was showing you everything. It was in backwards, but at least now you have familiarity with what the cover looks like. So this is what I call the core four for treatment for pandas and pans. Pandas and pans are autoimmune conditions that affect the brain, and the most common reason for a pandas or pans to occur is mold. So there's the connection. It's the mold, brain inflammation, immune depletion sets the stage for an infection to trigger this into an autoimmune disease where the body starts to attack itself at the brainstem, probably the gut, probably a little bit of the kidneys as well, but most of the symptoms are from the changes that are happening in the brain. So the autoimmune disease is the immune system saying, oh, this part of my brain kind of looks like this other microbe that I just fought, so I'm going to start attacking it too. So I have a core of things that I have seen in my practice that I use with pretty much every kid, and obviously everyone is a little bit of an individual, but these were the core, and I could have said core 10. As I wrote in my book, I said I disciplined myself to say core 4 because if you saw 10 as an overwhelmed parent of a kid with pandas or pans, you probably would throw the book against the wall and not ever open it up again. So it's core 4, and you're going to see these backwards, but they're just so I can go through them with you. Yesterday we did Tame the Flame. Today we're doing Beat the Bugs. Tomorrow we're going to do Regulate Immunity. And then Thursday we're doing Guard the Gates. And then on Friday it's just an open Q&A. We'll do a 12 o'clock lunch and learn where you can ask me questions about pandas, pans, mold. It's just going to be open, but hopefully it'll be about pandas and pans so that we can start to raise awareness and answer some of your questions, because I think that a naturopathic perspective of this is quite different than what you might be getting through conventional medicine. And you don't have to do an either or. This is not a situation where you have to pick one modality. There is no one modality that's perfect for every person in every situation. That's why I'm a big fan of marrying them both. So, the herbs produce the nutrition, the wisdom, and the drugs produce the targeted mechanistic action so that we can get the best of both worlds. So today is Beat the Bugs. And as I say in the Beat the Bugs, winning against the bugs often requires a multimodal approach. And so that's what we're going to talk about today. And I'm just going to talk through what are the things in the Beat the Bugs section. First of all, why is Beat the Bugs important? So yesterday we talked about Tame the Flame. You need to calm the body down so that you can start to administer the things that are curative for the condition. As you take care of the bugs and we regulate immunity, you need less and less and less of the things that tame the flame because you have less flame, you have less problems. But a lot of these kids are still dealing with the bug part. If it's perhaps a tick-borne infection, a lot of those go undertreated or untreated. And so we need to do something to make sure that we're really eradicating the bugs from the story of the kid. If it's PANDAS and it was strep, they may still have strep on their bottom. Perianal strep is a very common hidden reason for kids to continue to flare. And that's a really persistent infection. Like that needs to be treated both systemically, so it's something that treats the whole body, and topically, and then swabbed at the end to make sure that we got it because it is so persistent. So if you have a kid who you're starting to think, oh gosh, maybe the antibiotics aren't working or something like that, like every pandas and pans doctor should be checking the bottom of the child because there's these smoldering strep infections. So it's kind of like being a strep carrier, but it's worse because it's an actual infection that is continuously re-triggering the kid. It could be some of the viruses, the encephalitis viruses, that are allowed to kind of smolder in the body and we don't really catch it on all of our labs, and they're not sick enough with that virus, such as Epstein-Barr. Epstein-Barr is the virus that causes mono, and that's a really common reason for a PANS teen to develop PANS. And we just think, well, maybe they must have gotten over the mono And now we're dealing with this other PANS thing. Well, I think you might be dealing with both. And a lot of times in teens, when we really aggressively treat the Epstein-Barr virus, a lot of the PANS stuff settles down. So in this situation with PANDAS and PANS, we have environmental toxin load that depleted the immune system so that an infection could trigger the autoimmunity. So of course, managing the exposures, the envirome, is really important, but also making sure we're managing the bugs. So that's why this whole section is dedicated to beating the bugs, but from a naturopathic way of doing it, of course. So what's in Beat the Bugs? We're just going to go through it's 5 categories. We're going to talk to you. The first category is botanical avatars. The second is botanical antimicrobials. The third is pharmaceutical antimicrobials. The fourth is perianal strep, which I kind of already talked about. We'll circle back. And then fifth is long duration. So let's talk about these 5 things. Number 1 is botanical avatars. The way that I was trained in practice is that you set a foundation of support using what in herbal medicine is called a simple. A simple means you choose one plant that has many, many, many mechanisms of action that are the perfect match for the child or what their symptoms are. So what I put in my book is botanical avatars that hit all the mechanisms of PANDAS and PANS. So I'm just going to read them. What are the mechanisms that we're trying to get after? We're trying to have it serve as a broad spectrum antimicrobial. She'll love, I have to read my own book. Modulate the immune system, neutralize neuroinflammation, so get that brain swelling down, acts as an antioxidant for the brain and nervous system, reduce dopamine and glutamate. What happens is that the area of the brain that gets attacked with these is the area that normally receives dopamine, and those receptors get damaged. So they can't receive the dopamine. So the dopamine is floating around looking for a docking station. And, oh, is someone having a hard time hearing me today? Shoot. Okay, let me know. So it's looking around looking for a docking station, and if it can't find, thank you, can hear just fine, perfect. If it can't find enough docking stations, that dopamine will flood the brain chemistry, and these kids are working on way too much dopamine, way too much glutamate, because there's no dock for that. And so the cells that are able to receive that get hyperdopamined, hyperglutamated, and that leads to this excess brain chemistry that's very excitatory. That's where we see the obsessions, the compulsive activities or behaviors. That's where we see the tics. That's where we can see extreme behavior. That's where we can see some of the food issues, panic attacks. Yes, absolutely. So this is the brain chemistry piece that I don't know that a whole lot of doctors are talking about. And if they are, they're doing it through the medication route, which is a little tricky because these kids have high dopamine during a flare and then they bottom out on dopamine during in between flares. So we have to be working with a psychiatrist that is really in tune to the fact that this is a movable target that we're working with. The botanical avatars that I talk about in the Beat the Bugs section, they help to modulate all of this and actually repair the receptors, protect the other cells from damage from too much glutamate, too much dopamine. So boy, if there was only a perfect plant in the world that would do all this, right? Well, guess what? There's many of them. I picked like 7 to put in my book that were the top ones that I go to, but there are more than that. Also, what is a botanical avatar going to do? It's going to boost GABA, which is the brain chemistry that calms. That's our like chill brain chemistry. So a lot of these plants also boost GABA. So they're not only taking down the excitatory, they're boosting the calm part. They also heal the gut. They foster a healthy microbiome. And while some of them are not really strong antimicrobials, so if we're trying to treat an active infection, that's why we have number 2, the antimicrobials 2 and 3, which is antimicrobials of plants and the pharmacy. But if in between and as a base foundation for a kid, you can use these botanical avatars. An avatar means an ideal. So these are plants that are the ideal because they're hitting every mechanism of action that is going on with these kids. And what's really cool is, like I said in the beginning, if you weren't on, that possibly some of the challenges are an assault on the gut and also the kidneys. A lot of these botanical avatars also heal the kidneys, which is so cool. So what are they? You're probably chomping at the bit. Let's talk about who they are. Okay, we've got, yes, 7. Chinese skullcap, which is bicalensis. Chinese, that's Scutellaria bicalensis. And if you're, scrambling writing this down, don't worry about it. This is going to be recorded and put on my Instagram. So, you don't have to feel like, if I'm driving, oh my gosh, I gotta pull over. Don't worry about it. It's going to be recorded, and it's all in my book. So, and I highly encourage, if you're dealing with a kid with pandas and pans and this approach resonates with you, please do check out my book. I worked really hard to make sure that it was actionable, that things in there you can, number one, find, and you can get in a liquid form to get into kids, or a powdered form. I give doses, I give how to adjust it for the weight of your child. I give you a medication compatibility chart. That's free for anyone. You can go to my website, drcrista.com/med-compatibility, and you can get the chart it's live on my website. So it's constantly being updated as I learn more information. So you can feel really comfortable if your child is on a certain medication. You can compare the chart to see if it's safe to use those herbs. Okay, so back to botanical avatars. Chinese skullcap, that's Scutellaria bicalensis. Scutellaria lateriflora does have some activity against pandas and pans, or to support pandas and pans. But the bicalensis is more specific because it has more of a bitter, and the bitters are really what are doing a lot of the work, the heavy lifting. Oregon grapefruit. So those two have pretty strong antimicrobial activity, so you don't necessarily need to combine those with another antimicrobial. It just depends on the child. Of course, everybody is different. Chinese thorough wax, that's Bupleurum. This is used in a lot of Chinese formulas. Brahmi or Bacopa, it's kind of known in Asian countries as like the brain. It's kind of like with the go-to cola. It's just beautiful for like anti-aging of the brain. Well, guess what? It's also anti-neuroinflammation. That's how it's working to keep the brain healthy and juicy and still working. The one or two things I missed in my book. I missed nettles. In the Tame the Flame, I missed putting the herb stinging nettles. I use it all the time with pandas and pans kids. So that's in the Tame the Flame section. If you have the book, just write that in there on the Tame the Flame #2, mast cell managers. I highly encourage, just write it in there, because if I forgot, you're gonna forget. But maybe not. You probably have a better brain than I do. Okay, so Brahmi is Bacopa. I take Bacopa each morning. That's awesome. And then we have Magnolia. That's also very good for the liver. So if you have a kid where mold is also in the picture, which is a lot of them, then Magnolia will help. And then we have Silk Tree. So this one, Albizia, is the Latin. It is so calming. I felt really bad because I used to have my kids take it before they went to school. And then I was trying to figure out for one of my patients how to mix it in things. Like, what does it taste like? So we can kind of figure out what it mixes into. Like, is maple syrup better, or is ketchup better, or is salsa better? That kind of thing. And I got so spacey and sleepy. And I just apologized to my kids. I was like, I'm so sorry. I didn't realize how calming this is. And here I was giving it to him before bed. So Bacopa is a better one for morning, and Silk Tree, which is not Mimosa pudica. That's another silk tree. That's an antiparasitic. This is Albizia, and I love a product from Supreme Nutrition. They have a beautiful Albizia that's so good it can make adults fall asleep. And then go-to cola. So there's our Chinese skullcap, Oregon grapefruit, thorough wax, Brahmi or Bacopa, Magnolia, Silk Tree, and go-to cola. Go-to cola doesn't have a super ton amount of antimicrobials, so that one if I'm using that, I'm using it with another antimicrobial. So what are the botanical antimicrobials? Let's talk through the ones that I use a lot. In my book, I have a chart at the very beginning that shows you what bug are you trying to deal with and what of those is the better match, so that you know that we have activity. And all of this is backed up with science and studies. Someone is asking me how to do the nettles. Go to my website and go to the keyword search and just put in nettles. I have a couple of videos there about how to make nettles, how to harvest them. Definitely use gloves when they're fresh because they're called stinging nettles for a reason. You can use them in tea, you can eat them. They're a staple green in many countries. They should be in ours. And instead we spray them with chemicals. Yeah, so go to my website and there's a lot of resources there. The way that I get nettles tea into kids the most, into Pandas and Pans kids, is using lemonade, combining nettles with lemonade. It makes a really tasty nettles lemonade that can actually make the itching from a mosquito bite go away like that. So it's a great summer drink. Okay, botanical antimicrobials. We're going on to number 2. So number 1 is botanical avatars. Number 2 is botanical antimicrobials. Number 3 is pharmaceutical antibiotics or antimicrobials. Number 4 is perianal strep. Number 5 is long duration. So we're on number 2, botanical antimicrobials. What do I use? Very commonly, I'm using thyme. Thyme has one of the most broad spectrum activities. It's an antifungal, it's an antibiotic or bacterial, so it's antibacterial against the many bacteria, but particularly like a SIBO kid or a kid who doesn't have very good motility. Thyme is also an antiviral. It has some little bit of antiparasitic activity as well, but it's the most broad spectrum. It's also very, very safe. So they have done multiple animal studies to see, where is the mark where where thyme becomes not safe. And people were taking like 4 times the amount that they needed for the antimicrobial activity and had no side effects. And it doesn't shut down their immune system, or some of these things that people want to say about plants, like, oh, you don't want to take that because it'll teach your immune system not to work. No, these are nourishing. So think of it like a food. I mean, we use thyme in food a lot. So thyme, I'm going to whip through them. Thyme, echinacea, oregano, black elderberry, licorice, cryptolepis, Japanese knotweed, and black walnut, all for different reasons. Okay, so thyme is the anti-strep, mixed strep viral fungal picture. Echinacea is an anti-strep. It has specific anti-strep activities. Echinacea loves to play with other friends. It loves to be used with other plants. So if you're looking for an echinacea to use with your kid, I highly recommend mixing it with some of these other ones that I mentioned because it loves to work that way. It can cause a little more mucus. So if you have a real sinusy kid, those are definitely the kids where we're having to use like an inhalation stick and then give the echinacea because they might get a little more mucusy. Or something like a sinus probiotic that we just swab inside the nose. And in my book I have, and we're going to be talking Guard the Gates. There are tons of things that you can use in a kid's nose to help protect them from strep exposure. So there's a probiotic called Lactobacillus sacchii. You can find this as Lantosinus or Nasobiotex with an X. Kind of goofy website to find that. Somebody had another question about, yes, you can get nettles in supplement form for sure, so that you don't have a kid. Oh, thank you. So that you have a kid who, if they can swallow pills, just have them swallow the pill because then you don't have that war. Okay, oregano. Why is oregano on the list? Kind of like thyme. It's got a very, very broad spectrum of activities. I think someone asked thyme versus oregano, like, it's always a really hard question because they're both so beautiful. So a lot of times I just use them together. Black elderberry, that's going to be more your viral kid. So a kid who has one of those encephalitic viruses, that would be something like a Coxsackie B, a hand, foot, and mouth disease. Grown-ups get it too. And a lot of grown-ups, a lot of y'all parents who are fried are getting it, having it chronic, and sharing it with your kid. So you probably need to be taking a little bit of that black elderberry too. We know from past coronavirus studies, not this coronavirus particularly, because that's a naughty word these days, but past studies on cold viruses, which are coronaviruses, black elderberry was very effective at stopping the virus from coming inside the cell. Licorice, also antiviral, wonderful antiviral for the herpes family. So this would be the kid who got Epstein-Barr, so they got mono and they never really got past it. That would be when we're looking at licorice. Why is cryptolepis on there? That's for the tick-borne infections. many PANS kids got PANS because their mom, like I'm a sharer. I shared with my kids. I had Lyme, didn't know it, fibromyalgia, and shared a bunch of tick-borne infections with my kids in utero. They were born with it, which means they never develop a normal immune system. So there's that immune deficiency set up for creating an autoimmune problem. And so a lot of the tick-borne infections that are shared congenitally are kind of in what they call a static mode. They're not really necessarily in a growth state. They'll grow a little bit when the opportunity is there, but then they just kind of go into like this stationary form. Cryptolepis is one of the few plants, along with Japanese knotweed and black walnut, that's why all three are on there, that will affect these tick-borne infections in their stationary phase. It's so amazing. So you can get at them, kind of root them out of the hiding and get at these tick-borne infections. Okay, so that's why Cryptolepis is on there. Japanese knotweed is also kind of the same. Again, when I'm in like that moment of, am I going to use Cryptolepis? Am I going to use Japanese knotweed? I'm kind of, it just depends. Cryptolepis, do they need more bitter? Is it mold also? So they need more bitter, Cryptolepis. Do they need more anti-inflammatory, resveratrol, because they have brain fog and joint pain and asthma? Then I'm going to choose Japanese knotweed. So, and I talk about all of this in my book. How do you pick which one for which kid? And then black walnut is going to be for both the tick-borne infections, but also parasites, because these kids are very susceptible to taking on parasites. Kids testing positive for nematodes, super common in this population. Depending on the health of your child, we would use pharmaceuticals like albendazole in a pulsed fashion. We try to catch those worms when they're busy, when they're having babies, like new moon, full moon, and then maybe have a plant across the board. We might use the I word, ivermectin, which I don't know if I'm going to get banned for even saying that. We might use Alenia, so it depends on the kid, but I love to have black walnut as the base, if your kid can tolerate it. And again, I have all the doses in adult dose in my book, and then a chart to show you how to weight adjust everything for your child's weight, because their weight is what dictates the dose. When we share these things with our kids and set them up with immunodeficiency, is it possible to fix their immune system back to a normal one? Yes, we're talking about that tomorrow. Regulate immunity. It's really beautiful. We are made to heal. We're born to find homeostasis and health. If we just give the right nutrition and we give the right stimulation and the right stem cell food and all these things, like this is a repairable situation, definitely. So, I had to really work through a lot of guilt. Oh, good. You said the I word and you weren't shadowed. Okay. I think it's okay to say now, I think. So don't beat yourself up about sharing. You probably shared a lot of other things. I'm sure you're beautiful and you shared your looks, you shared your sense of humor. Maybe you're good at sports or you sing or whatever. You gave them lots of things. So this one is repairable. Very repairable. So tune in tomorrow, and if you can't, it's going to be recorded. So you can just check out my page. I think we're also going to try and get this on YouTube, so if that's easier for you. Okay, so now let's go to number 3, 4, and 5, and because we have 6 whole minutes, and I want to make sure I'm answering questions if they come. Big time guilt. Yeah. I know it. I had to work through a lot of that. Was there someone asking about testing for pandas and pans? I just want to reiterate if that was the question. I thought that I saw one of those questions go through. This is a clinical diagnosis, which means your doctor does not need a positive test to go ahead and start treating you. If your child meets the diagnostic criteria for pandas or pans, and they're a little different, the diagnostic criteria, they can diagnose it as that and they can go ahead and start treating. However, I would highly recommend that your doctor does not put pandas or pans in the chart. They should call it post-infectious autoimmune encephalitis. They should call it, I have what in the book, like what we're using, not to use pandas and pans, because that will become something that insurance will root out of the chart note and say, oh, if your child needs IVIG, they'll say, oh, you're trying to treat pandas and pans with this IVIG and not the low immunity, and they'll deny it. I know because it happened to me. We won a couple appeals and not all of our appeals. So make sure, and I've worked with patients on this, like now I know how to set the stage right to get insurance coverage for the IVIG treatments, which we can talk about tomorrow. So you only need a clinical diagnosis. Your doctor only needs to say, yes, clinically this matches, I can go ahead and start treating. Why this matters is this number 3, pharmaceutical antimicrobials, mixed with number 5, long duration. A lot of these kids need to be on prophylactics for a little while, prophylactic antibiotics or antimicrobial, whatever it is, like especially if it's Lyme disease. Strep will replicate every 4 to 6 hours. Lyme replicates every 4 to 6 weeks. And the antibiotics work on the bug when it's in its growth and division phase. So that's why if you are kind of starting and new down the Lyme pathway, Lyme trail, this is why your doctor might put your kid on a Lyme antibiotic for 3 months initially. And you might be thinking, oh, what the heck? That's going to ruin their gut. And that's okay, because the force that we're trying to combat is here, and we have to meet it with this force, and we can repair the gut. The gut is very resilient. So yeah, so pharmaceutical antimicrobials, I didn't put exactly which ones because that's your doctor's decision. They're going to need to prescribe it, that kind of thing. But I just wanted to say it's okay to use a botanical avatar, a botanical antimicrobial, and a pharmaceutical antimicrobial all at the same time and for a long time. And that's typically how this war is won, because the plants create the foundation and the wisdom. And then we can go in with this targeted, strong antimicrobial. And that's how the kid doesn't have to take as much of the drug. And that's how we get real success with this. And again, check out, for those that are just logging on, check out my medication compatibility chart. This is drkrista.com/med-compatibility. And you'll get the chart that's updated to the day you download it, because I'm always updating as I learn. And it will tell you what things you can do safely together. What botanical avatar can be used with which antimicrobial. And I just put the ones in there that we're typically using for PANDAS and PANS for all the infections we've just talked about. Okay, perianal strep we kind of talked about. Again, just a little note of like, always check their bottom. Always check their bottom. Always check their bottom. Strep hangs out there, and it can be the reason for continuous reinfection of the tonsils. So if you're on the verge of like, ooh, my doctor is recommending a tonsillectomy, is this an okay thing to do? Check their bottom first, because a lot of kids who need tonsillectomy, we could have saved their tonsils if we would have treated the strep on their bottom. Okay, so I saw a question, am I taking patients? I am not. I am really committed to teaching more doctors and helping people in a group way so I can stretch more of me. So I do have a membership. The membership is not necessarily specific to PANDAS and PANS. We're going to be starting a PANDAS PANS Parents Book Club. It's a mouthful. On February 21st, it's an 11-week program. So if you're interested in that, you can email me for more information. We'll talk more about that as the week goes on. How do I decide how much to treat at one time? So much bio-individuality. I love that question so much, and I addressed it in chapter 10 in my book, exactly how I do this. Like, how do you put all of these tools together? Maybe I can cover chapter 10 on Friday a little bit. That would probably be helpful. I'm gonna make myself a note and do that. I'll just show you the chart, and of course it'll be backwards for you guys, but I have a chart which is like the steps and how you would individualize it to your kid. And again, each of the things I've talked about, I give, especially for the botanical avatars, I give you a personality. So like the kid that is, so I'm just trying to think of like a good personality one to talk about in 30 seconds. So anyway, I match the personality. Like, does the plant grow high in the mountains in the most harsh environment, or does the plant grow in a swampy pond? You know, that's how you match it. You look at what the symptoms are with your kid. If they're a really swampy kid, or if they're just like, you know, taking on the world and they just keep having these struggles, it's like, okay, let's match the avatar personality to the kid, and then you get more simillimum. All right, that's our lunch and learn today. Join me tomorrow. We're going to do core 3, regulate immunity, and yes, IVIG will be in that. And if you have any questions about the book club, we don't have anything up yet about it, so we will, though. That's my goal, is to get that by the end of the week, so you know if you want to join us. Okay, y'all. Again, my heart is with all of you parents. As a fellow parent, remember, your kid can heal. That there's a way out of this. So if you're in crisis mode, just keep that hope. All right, mwah, bye.